Could I start, Doctor?
اتفضل يا دكتور.
Hello, dear professors and dear colleague. My name is Omar Abdelaziz Ismail. I'm assistant lecturer of operative dentistry, Delta University. And I'm a PhD candidate for restorative and aesthetic dentistry, Cairo University. I finished my bachelor and master degree from Tanta University. And since 2020, I'm a member of the adhesive group of Turku, University of Turku, Finland. Our team in this study, I already introduced myself, and Professor Dr. Randa Hafiz are the main supervisor and the data monitoring and the editing and the corresponding author. Dr. May Mamdouh, lecturer of conservative dentistry, Cairo University, the co-supervisor, and Professor Dr. Arto Tesverger, the head of cardiology and restorative dentistry department, University of Turku, Finland, for proofreading and reviewing. Our outline today will be, first of all, we will discuss the gap of knowledge and the problem we want to solve, what is dimethyl sulfoxide, our novel clinical trial, and cost effectiveness of our study, and the conclusion and take-home messages. First of all, the problem and the gap of knowledge. All of us know that the collagen is very sensitive. Make bonding to dentine is nightmare comparing to enamel. One of the reasons that we always have an exposed collagen and remaining water that will lead into subsequent hydrolysis later. Also, the collagen is very sensitive. If you are in exam, dear professors, and you see a student that dries the collagen after itching for like aggressive dryness for 30 seconds, I'm sure all of you will make this student fail the exam because he couldn't understand adhesion if you do so. How about if this become possible? You could dry that as much as you could. This means that a major shift in the guideline will happen, not just a novel idea. So let's see if that's possible. Dimethyl sulfoxide, as you see, is two groups of methyl and a group of sulfoxide. This organic component derived from wood pulp, and since 1960, they are been using as a medication in several medicines, topical and oral medications in the United States of America and other countries. Okay, what is the relation between dimethyl sulfoxide and collagen and adhesion? دكتور ممكن حضراتكم سامعيني كويس؟
سامعين اتفضل.
Because just show me a bad network recording. Okay. Okay, شكرا. First of all, the well-known Dr. David Pashley have a suggestion for Dr. Leo Tidirhani to use dimethyl sulfoxide and see its result. And in 2013, Dr. Leo Tidirhani published a paper, and it showed a significant improvement of the bond strength after using dimethyl sulfoxide. He only used low concentrations, less than 100% dimethyl sulfoxide. Then Dr. Hebling from Brazil have doing a cytotoxicity test to test dimethyl sulfoxide. Maybe dimethyl sulfoxide is safe to be used on a skin, and it's fatal to odontoblast. So we have to know. Dr. Hebling results showed that the low concentrations is very safe to be used, and it doesn't affect our odontoblast. Then in 2016, Ciego have used the dimethyl sulfoxide with the hydrophilic monomer, and also it's improved the bond strength up to 2%, but more than 10% dimethyl sulfoxide decrease the bond strength of the adhesive. It starts affecting the component of adhesives. So we now know that the dimethyl sulfoxide used are limited to the low concentrations. In 2017, if you remember the photo of the exposed collagen, this is a study, the Chinese from Wuhan University. Wuhan now after Corona become very, very famous. And it shows that if you see the red area in A and the red area in B, the red area represents the exposed collagen. After the dimethyl sulfoxide, it dramatically decreased. I wrap up not waste my time talking about to this very important systematic review in Hong Kong University, one of the most in Hong Kong University, and it was in 2022, and they found that this is the first systematic review about dimethyl sulfoxide. There's a lot of veterinary researches, but this is the first systematic review to collect all these veterinary researches, and they found that all the researches from Iran, Finland, from the United States showed that the dimethyl sulfoxide all improves the strength and improves the resin infiltration and decrease even it affects the matrix metalloproteinase enzyme. It causes inhibition to it. In this study, when Ciego in 2021 are using a 30. You remember the example I said? He dried the dentine for more than 30 seconds, and then it doesn't collapse. The collagen doesn't collapse. I were in Finland then, and I see if you look to the left side of the image, these beams are collected from one tooth after dryness of 30 seconds after dimethyl sulfoxide application. And on the other hand, the same tooth with the same technique after dryness of 30 seconds, only thing I could get, nothing to be tested. So you were right when you failed this student, because he is dry the dentine for 30 seconds. But soon, very soon, this will not be the situation. But this is not our work. This is to wrap up, just to wrap everything. But of course, this is not all studies regarding DIMSO. This is the very pioneer that guide us to understand dimethyl sulfoxide. So let's talk about our novel clinical trial in Cairo University. In vivo clinical evaluation of dimethyl sulfoxide dentine pre-treatment prior to a two-step etch and rinse adhesive randomized control trial.
Dr. Omar, you only have 3 minutes now.
Yes, I understand, doctor. I have a stopwatch here. Okay. The population is a non-cilious cervical lesion, and the intervention is 1% dimethyl sulfoxide. As I said before, it's better to use low concentration. The control is placing an etch and rinse at per single bond 2 without dimethyl sulfoxide pre-treatment, and the outcome we will use the FDI criteria to measure the outcome. Of course, there is inclusion and exclusion criteria, but we are out of time. The study, we designed it for 18 minutes. The trial will be parallel and equivalent framework, and the location ratio will be 1:1. Of course, we have ethics for a lot of committees in Cairo University before we start, and the patient have to sign the consent, and of course in Arabic, because we are treating Arabic spoken patient. This is the most important thing about my study. We registered the clinical trial since, if you see here, 13 July 2020. And this is a Q code. You could find every detail about my study. And lucky us, Cochrane have registered our study too. So we preserve our novelty, because till today in the morning, no one started clinical trial of dimethyl sulfoxide. At least he don't register it. But we face after that the situation of COVID-19, and it was very difficult to collect our patient. And finally, we could collect them. And for the sample size were made by Dr. Maya Mamdouh, and it was according 28 cavities in 28 patients, 41 peer group. And the setting, of course, in Cairo University. The sequence generation is using random.org, and the staff member not involved in the clinical trial who generate which is which. Sequence allocation is blinding for Dr. Maya Mamdouh and any assessor. So it's double blinding. The patient don't know which is which. Also, the examiner don't know which is which. This is the assessment chart we use using the FDI criteria. In this, a sample case of restoring sorry, we are out of time, and this is the 6 minutes of follow-up of one of our cases. The cost effectiveness of our study is that what I have said, the problems regarding collagen-related degradations in hydrolysis, microlysis, margin discoloration, loss of restoration, if we could stop that by improve the bond strength, of course, this will affect the cost, reduce the cost, because prevention is much less in cost than doing a restorative treatment. Conclusion and take-home message. First of all, collaboration. One of the most important things that help us in ensuring that our study are novel, because we know the data that the finish will get from Turku University even 2 years before publication. So collaboration between many universities is very important. When the COVID-19 strike China, it strike us all even in few hours. So if we face this together, we have face life together. We have to collaborate and stop doing the ancient way that one university should do the research so no one other should know. And the other take-home message, domicile clinical trial show a very promising result consisting with its vitro researches. So many clinical trials should start, because this should be available for GB dentists very soon. Thank you all. Thank you very much.
شكرا دكتور عمر. انا الحقيقه يعني ليا كومنتس على يعني على البرزنتيشن. انت you spend a lot of time الحقيقه giving us a review يعني and you can يعني condense it within 1 or 2 minutes. ما عرفناش احنا الحقيقه يعني your result يعني ما فيش result you already get. وبعدين كمان ليا تعليق على الابستراكت كمان. you didn't mention in the abstracts I know ان هو limited words, لكن الابستراكتس you should mention in it the material method in brief and also the result. You didn't mention this in your abstract. فدي my comments about your presentation and your abstract. اتفضل.
About result, my professor thinks that because we will need like 1 year, we will have the 18. We have only 1 year follow-up result. We will have the 18 months follow-up result by June. So we hope to present the 18 months follow-up result in China. It will be ready then.
ساعتها you can present. يعني انت دلوقتي يعني your data is not complete. وبالتالي يعني يعني ايه الداتا اللي هتتعرض؟ فدي مش عارف يعني ده اعتراضي على
At this time we will have the 18 months result finished, because they said they have concerns that this session is recorded and it will be uploaded, so they don't want to share all the result yet. But I could send it to you, doctor, by email.
No, يعني I mean the presentation itself. يعني thank you very much anyway. Now it is open for discussion. Prof. Ilham.
I think I was after Dr. Hamdi and Dr. Insani and Dr. Mona, so that they were before me. So please proceed.
Okay. Dr. Hamdi. دكتورة منى.
شكرا دكتور محمد، شكرا لحضرتك، شكرا دكتور عمر على البرزنتيشن. تمام. دكتور محمد غطى حاجات كتير جدا انا كنت هقولها. طبعا احنا اهم حاجه من العرض، تمام، ان انا ابقى اعرض كويس. تمام. ما حدش بيقول على الاستادي بتاعته نوفل، صدقني. تمام. الناس اللي يقول على الاستادي بتاعتك نوفل، اوكي، لكن انت عمرك ما تقول على النوفل استادي. ممكن تقول ان هي ذا فيرست وان، ماشي، اب تو يور نوليدج يعني. تمام، زي ما اتفقنا النقطه دي. فدي نقط ممكن انا عامل حاجه هايله بس ما قدرتش اوصلها، اوكي، وده اللي حصل للاسف. انت ضيعت زي ما الدكتور محمد اراوند 70% من البرزنتيشن بتاعك، اوكي، في وان سلايد. بالنسبه لي هي وان سلايد، اوكي. يو توك اباوت ذا انترودكشن. تمام. انا جيت اقيمك دلوقتي على الستادي ديزاين بتاعتك. تمام. انا مش هرجع للريفرنس، انا هنا البرزنتيشن هو ده اللي انا بقيم عليه. تمام. فطبعا انا مش عارف مين البيشنت الانكلودد، انت عملت ايه؟ انت عرضتها بالظبط في 3 دقائق. تمام. فالحاجات الفوكس، طيب ايه تايب اوف ريزلتس انت عندك؟ مش عندك. اوكي. you can keep the novelty. you can keep the novelty. اوكي، دي مفيش فيها مشكله. اوكي، بس ما حدش هياخد منك حاجه. اوكي، هقول لكم على يعني حضراتكم حضرتم برزنتيشن كريم النوفل بارت بتاعه البرزنتيشن بتاعه ازاي يحضر الماتيريالز. تمام. ودي لا يمكن هتتكتب، لان دي قعدنا 7 شهور ترايل اند ايرور عشان نوصل لها، لكن اتكتب ان في تي سي بي بيزد ماتيريال. خلاص وات ايفر حضرتك عاوز تعرفها، الديتيلز مش مهمه في النقطه دي، لكن هي اوريدي حضرتك اللي هي تي سي بي موجوده في النقطه دي. فدي النقطه يا دكتور عمر اللي خلت للاسف انا ما اقدرش احكم البرزنتيشن بتاعك او اديك درجات عاليه. تمام، لان اي هاف nothing. النقطه المهمه جدا يا دكتور عمر، طريقه كتابه الابستراكت you should follow the guideline للمكان اللي انت هتعمله. تمام. انا شايف هنا there is nothing follow the guidelines of IADR. يعني حتى انت ما فتحتش الاركايفز بتاعه IADR علشان امشي زيه. تمام. طريقه فين الاوبجكتيفز، الماتيريال والميثودز مش مكتوبه بطريقه ويل ديزايند، الريزلتس بتاعتك ما فيش فيها اي سم سورت اوف احصاء وريبورتنج للاحصاء. الكونكلوجن از فيري فيج، ما فيش حاجه اسمها تيك هوم مسج في scientific presentation. تيك هوم مسج دي لو حضرتك بتعمل جنرال برزنتيشن او بعمل حاجه فيري جنرال. اوكي، يو هاف ريسيرش برزنتيشن. تمام. وانت يو نو ان توركو، وانت حضرت برزنتيشن ان توركو، research presentation is a research presentation. Okay, you don't have a background, a long background. مفيش حاجه اسمها ان انا هقيم طالب بتاعي يسقطه او انجحه، دي is not a research presentation anymore. تمام. فسامحني البوينتس دي خلي بالك منها، احنا كلنا في learning curve. تمام. لكن as a research presentation for IADR you don't follow at least maybe 4% or 5% from الحاجات اللي انا هقيمها للاسف. تمام. فسامحني للكلام ده، بس اقبلوا مني is a learning curve. تمام. كلنا بنتعلم from our trial. شكرا جزيلا يا دكتور محمد.
لا ابدا، بالعكس يا دكتور عمر، انت بالعكس انت المفروض ان انت بتستفيد من التعليقات دي وتاخد بالك منها بقى، يعني take this home message and يعني take care about it later on. دكتورة بروف إنسانية.
Okay, thank you, Dr. Omar, for your presentation. Actually, I have a question from the website that you refer to in your abstract. You mentioned that DEMSO improves the bond strength because it acts as a, a penetration promoter. But at the same time, you mentioned as well that DEMSO will dissociate the highly cross-linked collagen into apparent collagen fibrils, which means that DEMSO will reduce the cross-linking of collagen network. It means that it will increase the degradation of collagen. And this means that it will reduce the bond strength, not improve it. So how can you explain this, contradiction, if you don't mind, please?
No, the DEMSO improve stiffness of collagen fibers, so it doesn't collapse. Even after air dryness, it doesn't collapse. So when the collagen fiber becomes strong, it enhances and maintain its structure, not collapse. It enhances the resin infiltration. It have other way of functioning. It inhibits the matrix metalloproteinase enzyme. This happened for this showed for the after long term of aging. They found that the specimens that treated by dimethyl sulfoxide have less activity of matrix metalloproteinase enzymes.
Yeah, I agree with you in all these points, but how come DEMSO will increase the dissociation of cross-linked collagen? Because this contradicts what you just mentioned right now.
Do you mean the studies? Do you mean the systematic review study, doctor?
No. In your results, you refer to, you sent us a website, yeah, a link.
The clinical trials registration.
Yes, your clinical trial, yeah.
Yes.
So you mentioned there that DIMSO will dissociate the cross-linked collagen into apparent collagen fibrils, which means that this is totally the opposite of what you just mentioned right now. So you might need to check it if you don't mind, please. Yeah.
Okay, I'll check it, doctor.
Thank you.
Prof. Ilham.
Thank you. Thank you, Professor Awad. Actually, I wanted to tell Omar that during the presentation, he has to be sequential. He doesn't have to go on into the slides and then go back. And everything has to be very concise. He should move from one point to the other, and he should actually identify from the beginning whether it's a two-part study or one-part study. He didn't mention at the beginning that there was a clinical trial entitled in the presentation, so there should always be a sequential approach to the presentation, and above all mention the clinical relevance, and had to identify the control very clearly, and the statistical methods, and why did we mention all the detail, all this approach, rather than moving into the regular and standard profile and techniques of our bonding. Omar, you need to revise very well your methodology and your presentation, and the sequence of passing the information, because you can, as mentioned before, you can do a lot of work, but be unable to present it the way you should. So please refine your presentation. Thank you.
Thank you.
Any other questions? Thank you very much. We will move to the last session, please. Thank you, Omar.